Chapter 37 to 47. The various roles in home health. Chapter 37. The role of case management in home health. It is important for nurses to know the various roles in a home health agency in order to effectively communicate their report to the agency. Nurses who know the roles in home health agencies can better utilize the agency for the benefit of the patient. The role of case management in home health is to implement treatment plans that will help patients meet their rehabilitation and quality of life goals. The role of a case manager in this field has multiple facets, and it is important to understand what these different roles entail. This article will discuss the functions of this type of professional, as well as their qualifications and financial responsibilities. It also covers the benefits of hiring a case manager. Functions. In home health, case managers collaborate with other healthcare professionals to provide services. The process includes assessment, planning, coordination, evaluation, and advocacy. The goal is to improve health outcomes while achieving the optimal wellness for an individual. Case managers coordinate services, consult with physicians, and implement care plans for their clients. They are trained in the specialized knowledge of healthcare and work to promote health and well-being throughout the care continuum. The primary goal of a case manager in home health is to provide care to the patients who may be experiencing a variety of conditions. Home health case managers will develop treatment plans to help patients achieve a higher level of independence and improve their quality of life. Effective home health case managers are trained to recognize and respond to potential complications, ensuring that patients receive appropriate care to meet their goals. Case managers must also be certified to provide care in the home setting. Coordination involves organizing, integrating, and modifying resources to meet the needs of the client. Planning also involves monitoring progress and seeking feedback. The evaluation is done at specific milestones to determine whether the care plan is helping the client meet their goals. Communication back to the service providers helps them understand and support the client's progress. Education involves helping the client learn about important health topics. After discharge, care coordination is crucial. Effective case management requires the case manager to work with a variety of people. These professionals work with patients, family members, and healthcare providers to identify needs and ensure the right services are provided. Case managers also educate patients and their families on available benefits and services. When dealing with different professionals, the case manager should be aware of different perspectives and ensure that everyone is comfortable with the process. The role of a case manager varies from organization to organization, but many functions are similar no matter what type of environment the manager is in. The case manager is the main caregiver for a patient. The case manager establishes a relationship with the patient and their family, facilitating communication among the different members of the healthcare team. Using this knowledge, the case manager can adjust a patient's treatment plan or arrange more effective home care services. Case managers empower the patient and advocate for their health. They also work with other caregivers, such as physicians and hospital staff. Benefits. When deciding whether or not to use case management in home health care, there are several factors to consider. While the process is largely the same across settings, there are some differences. Case management programs are often not focused on chronic illnesses, as the majority of guidelines focus on a single disease or condition. The case manager should focus on a patient's needs, not the circumstances surrounding their illness or condition. The best way to determine if case management is right for your client is to assess the need and requirements for their care. Case management is an integrated process involving assessment, planning, facilitation, evaluation, advocacy, and communication. It promotes quality outcomes and cost-effective outcomes by optimizing health and wellness. Case managers provide timely access to important information and facilitate informed decision-making, improving the quality of care and maximizing member insurance benefits. In home health, case managers improve patient outcomes and increase the utilization of home health care services. Here are a few of the benefits of case management in home health. The intervention group reported a higher level of dependence and overall decline in function than the control group. Earlier, these patients would have been kept in a hospital and transferred from service to service. Case management nurses, however, provided telephone assistance to patients in these conditions, which may have contributed to the reduction in general services. It seems that case management nurses may complement the community nurses' role in home care and improve their performance. Case management helps home care professionals link their clients with appropriate providers of care. They also coordinate with other healthcare providers to ensure that the client receives safe, appropriate, timely, and equitable care. As a result, Case managers ensure optimal value for all stakeholders. So, when evaluating the benefits of case management in home health care, it is important to remember that case managers should also coordinate with other service providers. And once the client is comfortable with the care, the case manager can facilitate the delivery of care. The role of case management in home health care is vital for the successful management of care for patients with chronic illnesses. It helps prevent unnecessary complications and improve quality of life for patients and their families. Home health care case managers coordinate the efforts of the team members involved and help patients reach their goals. They use strong communication skills to coordinate the work of the healthcare team, and they provide an excellent environment for teamwork. And they do all of this in the comfort of their own homes. Qualifications. Qualifying as a case manager in home health care requires post-secondary training. Most employers prefer candidates with at least a bachelor's degree in a relevant field. You can major in nursing, healthcare administration, health sciences, or human services and minor in case management. Earning a master's degree may also be advantageous, as it may translate into increased responsibility and a higher salary. Master of Public Health or Master of Science in nursing degrees are highly desirable for this position. Case managers are typically responsible for collaborating with multiple disciplines to ensure that the best possible care is provided for the patient. They are responsible for evaluating and coordinating services for patients who need a wide range of services. Experience in the medical field is also an asset for case managers, as they often deal with complex medical conditions. Knowledge of medical terminology and procedures is also important. This background helps them better understand the needs and wants of patients, which ultimately leads to better patient outcomes. Case managers often have numerous tasks to complete each day, including scheduling appointments, filling out paperwork, communicating with patients and other healthcare professionals, and meeting important deadlines. After assessing the client, the case manager will develop a plan of care for them. This plan is action-oriented, time-specific, and multidisciplinary, and considers the client's needs. Case managers must collaborate with the client's support team and healthcare providers to ensure that the transition is safe and successful. These professionals should be able to communicate with all relevant healthcare team members, including the client's family members, medical staff, and social services. The process of case management involves assessment, planning, facilitation, evaluation, and advocacy. The goal of the process is to help the client attain optimal wellness while ensuring appropriate use of resources. Case managers need to ensure that reimbursement sources are properly accounted for and that resources are maximizing value. Case managers should be certified and have the necessary skills to perform their job. A certification will demonstrate the individual's competence in the field. Financial responsibilities. In the field of home health care, the financial responsibilities of case management are a critical component of the job description. These managers oversee the finances of their organizations and implement measures to improve revenue generation and streamline expenditures. They allocate funds to purchase cutting-edge medical devices and equipment and provide clinician training to improve the quality of patient care. Home health case managers also work to monitor their team's performance and incorporate client feedback into their operations. A bachelor's degree in healthcare management or related field is required for a position in the field. An associate's degree is acceptable, but an advanced degree is highly recommended. Case managers must be able to apply their knowledge of business operations and compliance, and be well versed in health information technology, Medicaid cans, and healthcare quality management. A strong communication and active listening skill is a must, along with analytical and quantitative reasoning. Although most case managers are often in the office, a home health case manager must be able to meet with sick patients on a regular basis as needed. Because of the exposure to disease and infection, the case manager is at risk of contracting illnesses. To avoid such risks, case managers must also be certified and licensed by the Commission for Case Manager Certification. This certification can further differentiate you from other candidates. There are many other responsibilities that a case manager can have. Case managers are crucial to the success of an organization. The role of case management in home health care is vital for both the quality of patient care and the reimbursements of providers. Case managers should receive the necessary training in order to maximize their effectiveness. The case management training solution was developed by experts to address the most critical care coordination challenges, minimizing financial and compliance risks. A case management training plan for case managers is important to ensure the success of a home health care business. Chapter 38. What is SN in home health skilled nursing? SN is short for skilled nursing. An SN can either be an RN or LVN. RN visits patients for observation, assessment, and evaluation. Home health nurses also keep journals of each patient's condition. These visits are non-reimbursable. RN visits are required for COVID-19 monitoring and may be provided in the patient's home for the duration of the illness. Home health nurses are often not reimbursed, so they must seek reimbursement from insurance companies. RN visits for skilled nursing observation, assessment, and evaluation. An RN must make at least one on-site visit per 60-day episode to supervise home health aides who are performing skilled services. In addition to on-site visits, an RN can also make virtual supervisory visits. This is possible through two-way audio-video telecommunications technology. However, the RN must be a skilled professional. For this reason, an aide cannot exceed one virtual supervision visit per patient per 60-day episode. A licensed RN must make an initial assessment visit to determine if the patient needs immediate care. The nurse must also determine if the patient meets Medicare requirements for a home health benefit and is homebound. If this is the case, the RN must make the home visit within 48 hours of the referral or return home date. It is also necessary to note that a skilled nursing visit is not a substitute for a doctor's care. Using a 10th percentile value of total visits, the federal government has established payment thresholds for RN visits for skilled nursing observation, assessment, and evaluation. For case mix groups, the threshold is 2 visits per year. The RN should make at least one of these visits per client per day. A skilled nursing visit can prevent admission to a hospital or a nursing facility. Moreover, RN visits for skilled nursing observation, assessment, and evaluation in home health are mandatory if the patient has a prior diagnosis of a medical condition. If the diagnosis is not correct, the patient will have to undergo another assessment visit. During the assessment visit, the nurse must also observe the patient's daily activities. During the observation visit, the nurse should also make sure the home health aides are able to perform their duties properly. RN visits for skilled nursing observation, assessment, and evaluation in home health may also include medication administration. An RN may administer intravenous medications or administer an infusion. The purpose of these visits is to administer medications. If a licensed nurse is necessary for the administration of these medications, a visit for medication administration will be considered a skilled nursing observation. For other medication administration tasks, a skilled nurse may be required to perform a full assessment of the patient's medical condition. Intermittent skilled nursing visits involve direct, skilled nursing services. Such visits are generally shorter than 2 consecutive hours and are based on the member's individual needs. A licensed registered nurse or a licensed practical nurse may perform these tasks safely. RN visits for skilled nursing observation, assessment, and evaluation in home health are also called short-term RN visits. Home health nurses keep a journal of each patient's condition. Home health nurses are entrusted with the patient's well-being, driving to their home to provide care. Home health nurses often serve as live-in caregivers, using critical thinking techniques they would use in the clinical setting. They monitor the patient's vital signs, pay attention to complications, and follow a physician's orders for home treatment. Home health nurses keep meticulous records of each patient's condition. When documenting care, home health nurses must remember that written records are admissible in legal proceedings. A nurse's written records include every patient's condition, as well as those related to her scope of practice. As a nurse, you should involve the patient in the record-keeping process and ask for their input when developing the plan of care. The patient should also sign the journal, which contains important information about their medical condition and lifestyle. SN in home health skilled nursing. RN, LPN, or LVN level nursing professionals provide skilled care to patients in their homes. Each visit requires the completion of detailed nursing notes. Medical documentation is required to support the skilled level of care, including the patient's current medical status, medical equipment needed, and the estimated period of in-home services. A physician's approval of the RN or LPN must be granted, which is based on the unique medical condition of the patient and overall safety. Medicaid-enrolled individuals are typically furnished with services through a network of contracted MCOs or providers. Providers must confirm eligibility prior to rendering services. They may require a referral or prior authorization from the Medicaid program. Moreover, providers must follow the state and federal regulations as well as the MCO's provider's manual. These guidelines are necessary for the care of Medicaid-enrolled patients. Depending on the situation, intermittent or part-time home health skilled nursing services are reimbursable. If the patient can't make the required supervision visits, the RN or home health aide may be substituted by a skilled therapist. However, Medicaid doesn't reimburse intermittent or part-time home health skilled nursing visits without proper supervision. A physician's visit must be a critical part of the patient's overall care. Unlike inpatient care, participants must be under the care of a licensed practitioner. The practitioner may be a physician, nurse practitioner, clinical nurse specialist, or a physician assistant. The practitioner may be a private physician or one who works on the staff of a home health agency, or ALF. A physician can also be a part of a hospital-based home health agency. Chapter 39. What is a home health aide? Home health aides typically perform unskilled patient care intermittently around 30 to 45 minutes at a given time, a certain number of times per week, as one of the representatives of the home health agency. Sometimes they are referred to as certified home health aides. CHHAs perform similar functions as certified nurse assistants in the hospital setting. Health aides work alongside SNs such as LVNs and RNs in performing delegated tasks. As such, they do not have much liability, as the liability tends to go to the more credentialed nurses. Still, in California, home health aides must complete a minimum of 12 hours of annual training, undergo tuberculosis testing, and have a criminal background check. The certification must be renewed every 2 years. Job duties. Job duties of a home health aide include assisting patients with their daily activities and documenting any changes. Home health aides also perform some housekeeping tasks. They may prepare meals, assist with transfers, and perform light housekeeping duties. In addition to these duties, home health aides may be responsible for providing companionship and assisting with personal hygiene. Aside from the above, job duties of a home health aide can also include assisting patients with their daily activities and administering medication. Aside from taking vital signs, a home health aide also monitors a patient's condition and communicates with their supervisor. They also teach the patient to take care of themselves and their loved ones. Home health aides also provide personal care and advice to patients on proper diet, housekeeping, and hygiene. The work of a home health aide requires full attention and understanding of the reactions of the patients and family members. Working as a home health aide requires that you be at least 21 years old and possess a valid driver's license. In addition, the job requires that you have strong listening and communication skills, and that you have a sense of responsibility and self-control. These qualities are important because you will be dealing with people who have memory issues, cognitive impairments, or behavioral problems. Aside from these characteristics, a home health aide must be organized and have strong organizational skills. Besides, a home health aide must be able to run errands and other tasks along the route. In addition to possessing the necessary certifications, home health aides should be compassionate companions. Empathy is a vital trait for a home health aide, as it helps establish a strong bond between them and their clients. While seeking a home health aide, be sure to ask questions about their background, personality, and past work experience. This information can help you pair your family member with the right home health aide for your specific needs. Training requirements. Depending on the state usually requires a 75-hour training course for home health aides, which includes at least 16 hours of hands-on skills training. Training programs must be approved by the state and the Department of Health, and they must cover health-related tasks. In addition, they must include 35 hours of classroom instruction, 16 hours of supervised practical training, and 50% patient care-related experience. Live virtual training is also permitted. New employees must attend training and orientation. This training may be provided by the agency, but it does not count toward annual and service requirements for aides. In addition, documentation of training and competency evaluations must be maintained in the aide's personnel file. It must support the training requirements and the annual performance evaluation. The program must also adhere to the guidelines of the board. If it does not, it should consider reapplying for approval. Home health aides often spend most of their time with the same patient. As such, they develop close relationships with the patient and become a constant companion. This personal connection makes them a valuable member of the healthcare team and helps them monitor their condition more closely. They also report any changes to doctors and family members. Ultimately, this is why home health aides are important. For this reason, home health aides need to have excellent communication skills. In addition to providing in-service training, home health aide training programs must also provide comprehensive classroom and supervised hands-on training in non-nurse aide skills. These skills may include taking blood pressure, maintaining a safe home environment, and assisting with medication administration. A home health aide must also be capable of observing and recording in a home health care environment. Unlike nurses, home health aides are not required to complete their nursing education, but the training must include the essential skills for the job. Home health aide training hours vary from state to state. The federal law requires 75 hours of hands-on practical training, including at least 16 hours of clinical practice. Other states require more training, requiring CNA or nursing degrees. In Washington, D.C., for example, aides must complete an application fee, pass a competency exam, and undergo a criminal background check. Chapter 40: The role of the physical therapist in home health. Home health physical therapy involves a licensed therapist coming to a patient's home to provide individualized treatment plans, typically involving the gross movements of the musculoskeletal system. This specialized service is designed for patients with acute conditions or limited mobility, and is covered by most insurance plans. Home health physical therapy focuses on improving a patient's strength and mobility. It can also help a patient who is recovering from an illness or injury. Most patients receiving home health physical therapy are referred by a healthcare provider. The healthcare provider can vouch for the medical necessity of home care physical therapy, as outlined in the patient's medical necessity report. In this case, the healthcare provider will likely state that the patient cannot leave the home due to his or her condition. However, patients with mobility issues may also choose to use an outpatient physical therapy clinic to receive PT at home, although it may conflict with the home health agency they are currently using at the time. In such cases where the patient decides to keep their current home health agency, the physical therapist will provide exercises for the patient to do at home. Unlike a traditional PT, a PT in home health physical therapy has more flexibility in their schedule than in traditional settings. Often, they are allowed to visit the store and post office in between patients. However, in some cases, they are required to cover another therapist's patient or to adjust their schedule for the day. They also must manage the area and patient load, which may be more demanding than a traditional job. As a PT in home health, they will be responsible for assessing a patient's care needs and evaluating their level of function. They will also develop a treatment plan and advise the patient's family regarding their condition. The occupational requirements for a PT in home health physical therapy vary depending on the state you live in. Physical therapists typically provide paperwork handouts to patients and their families of the prescribed exercises they can do at home. It is up to the therapists and nurses to make sure they follow through on doing their exercises at home so the patients and their family become more independent. A PT in home health care works closely with patients who are recovering from an illness or injury. They are a problem solver and focus on restoring patients' functional movement. Therapists strive to help patients avoid prescription pain medications or surgery and focus on improving their quality of life. A PT is also sensitive to the emotional aspects of recovery. Chapter 41: What is home health occupational therapy? Occupational therapists are trained professionals who assess a patient's functional needs and help them learn new skills. OTs are typically mistaken as PTs, and although their job functions overlap, they have distinct differences, as OTs focus more on the fine motor skills and activities of daily living. PTs focus more on gross mobility such as walking. Occupational therapists. Occupational therapists in home health have a variety of different roles, from helping people adjust to new situations to managing the symptoms of a chronic illness. They assess a patient's needs and abilities to develop a plan of care to make their lives easier. Occupational therapists help patients manage daily activities by helping them adapt to the environment and the limitations of their physical capabilities. The work of an occupational therapist can vary greatly depending on a patient's health and ability level, the nature of their illness, and the location of their home. The most common reason to use occupational therapy is to improve independence. As people age or develop illnesses, many of their daily activities can become difficult. Occupational therapy can help patients adapt to these changes and integrate into their social situations. Home health assessments allow occupational therapists to develop individualized plans for each patient. Occupational therapists may recommend training and equipment to assist a patient with daily activities, or they may even guide family members and friends on how to care for themselves and their loved ones. Home health services may be covered by Medicare if a patient's condition is serious enough to require occupational therapy. Occupational therapy is not yet a primary provider of home health services, so its coverage rules may vary by insurance company. However, the government does provide occupational therapists with a limited scope of practice. Its role in home health care is an essential part of home health, and is essential once other services have been completed. Home health therapists specialize in helping patients recover from injury or illness by improving their ability to perform daily activities. Like physical therapists, occupational therapists help patients improve their physical movements. Their job title, however, is more specific. These professionals may assist patients with work or leisure activities as well. A home health occupational therapist can help those who are recovering from a stroke or other physical condition. Occupational therapists assess needs. Occupational therapists assess a patient's home health needs to determine which modifications need to be made. Common home modifications include removing falls hazards, rearranging walkways throughout the home, and installing equipment such as handrails, grab bars, slip-resistant flooring, and medical alert systems. Because older adults often have multiple chronic conditions and take multiple medications, they need to be monitored for adverse drug reactions. Occupational therapists assess the needs of patients in their own homes to provide home health services that improve their quality of life. With their expertise, occupational therapists help patients develop and maintain skills that enable increased independence. Many people have trouble with their mobility after major surgery, or suffer from significant illnesses or conditions that decrease strength. Brain damage can also limit one's abilities and make daily activities difficult or impossible. Occupational therapists assess these needs and recommend appropriate resources. Many older adults struggle to perform basic tasks. Occupational therapy can help them stay active and independent in their own homes by teaching them how to complete everyday tasks without straining their joints. It can also address the mental health issues of older adults, such as depression. Occupational therapists help older adults learn how to cope with depression and other mental health disorders, while teaching them how to structure their day and break down tasks. While there are many issues facing the profession of home health care, OTs are crucial in addressing these challenges. In home health, OTs assess clients' needs and create routines to optimize client compliance with the home care plan. Despite the importance of occupational therapy, the profession is still not recognized as a necessary part of home health. AOTAS Federal Affairs team is working to improve this situation. AOTAS efforts on the PDGM bill have been fruitful. In addition to these changes, AOTA is also working with home health agencies to recognize their occupational therapy qualifications. Therapists help prevent falls. Home health PTs and OTs often help elderly clients with fall prevention. Occupational therapists can help patients reduce pain medication and reduce opioid use. They can help improve home safety by removing hazards and recommending equipment, and training users to reduce risk of falling. And OT can help clients develop a greater sense of self and decrease fears of falling. They can also provide additional information to help the client become more independent. The role of occupational therapists in home health is to help their clients learn essential skills and perform daily activities. Because falls are one of the leading causes of injury among the elderly, occupational therapists are required to educate themselves on fall prevention. They should teach residents to reduce the risk of falling by modifying their environment and making changes as needed. This will help individuals feel more confident with their daily activities and avoid self-limiting behaviors. Home safety evaluations are another key role of occupational therapists in home health. They evaluate a patient's home and recommend equipment that will enhance independence while reducing the risk of falls. Home modifications may include removing throw rugs, installing grab bars, or rearranging walkways throughout the home. Occupational therapists may also recommend elevating sitting surfaces and removing cords. The risks of falls are complex and can stem from the environment, activity, and health conditions of older adults. Aged adults typically lack the physical stability to keep themselves upright. Women are at a greater risk than men. Individuals with chronic health conditions, recent hospitalization, and history of falls are at higher risk. A fall can also be a result of sedentary lifestyles, a weakened immune system, or other health conditions. Chapter 42: What is a speech therapist in home health? A speech therapist, also known as a SINT, is a member of the healthcare team that provides speech therapy services to patients. They perform their duties according to the standards of clinical practice and work under the supervision of a physician and nursing supervisor. Job description: a speech therapist in home health is responsible for the evaluation of patients' care needs and determining a treatment plan that will improve the patient's communication, swallowing, or cognitive skills. This person also evaluates the client's home environment. A speech pathologist also documents the progress of each client. A typical job description of InSint in home health is as follows. The job description of InSint in home health includes evaluating the patient's level of function using evaluations and basic audiological assessments, especially if the patient has dysphagia or risk for aspiration with difficulty swallowing. They also work with the healthcare team to develop a treatment plan. During each visit, the speech therapist completes progress notes and submits them per the home health agency's policy. As a member of the home health team, the speech therapist administers therapy and guides the patient in the use of communicative devices. They also participate in case conferences and prepare clinical notes and reports any changes to the physician or supervising nurse. A speech therapist in home health can provide in-home services to people with physical, mental, or cognitive disabilities. A home health speech therapist may assist nonverbal stroke patients in learning to use text-to-speech technology. They may also test the patient's ability to swallow and trial different liquids. Occasionally, they will instruct the patient's family how to prepare pureed foods safely and effectively. Qualifications. To work in home health, a speech therapist must have a master's degree in speech-language pathology or another related field. Some states also require that a speech-language pathologist be certified and licensed. Other essential skills include excellent interpersonal and nonverbal communication, patient and analytical thinking. Home health speech therapists must also know the proper tools for rehabilitation. They must be well informed about different types of rehabilitation equipment and their use. In a home health setting, the speech-language therapist will visit the patient in their own home to treat speech, swallowing, or cognitive disorders. They will work closely with other care providers in the home to tailor therapy sessions based on the patient's specific needs. The home environment will help the speech therapist work with the patient to get the best results possible. This includes the patient's family and caregivers. Home-based speech-language pathologists are highly trained and experienced in providing therapy services in a wide variety of settings. They also maintain accurate records and are required to comply with the highest standards of clinical care. Chapter 43: Medical Social Worker in Home Health. Duties. A medical social worker in a home health care setting performs a variety of important tasks to ensure that patients are receiving the highest quality of care possible. They provide support and assistance to patients and their families, as well as coordinate services such as medication, home care, counseling, and transportation. They may also provide counseling on community resources. For example, California patients with Medi-Cal benefits may be eligible for IHSS compensation. This IHSS benefit allows eligible patients and their families monetary compensation to acquire a live-in caregiver, or compensate their family for providing care to the patient since they are taking time away from their typical work duties. MSW also assist law enforcement officers and perform investigations. This may be if there is suspicion of elder abuse in the home of facility. Duties of a medical social worker in home health care vary widely, but they typically focus on the emotional and physical needs of their patients. Medical social workers also help patients navigate the healthcare system. These professionals coordinate care for patients after they have been discharged from the hospital. They also help patients schedule appointments, medications, and therapy sessions. These social workers may be involved with both inpatient and outpatient care. These individuals often help patients and families transition from hospital to home health care. Some medical social workers also help coordinate home health services and train other healthcare staff to provide patient-centered care. A medical social worker in home health must have strong interpersonal skills, a thorough understanding of patients' needs, and problem-solving skills. An emotional, stable, compassionate attitude is crucial. Those who wish to pursue this career should have a master's degree. A medical social worker in home health care provides comprehensive, non-clinical care to patients, in addition to assessing and treating physical health conditions. The job requires an individual with excellent communication skills and excellent listening skills. Experience in a hospital or other healthcare setting is advantageous, since it helps them become familiar with medical terminology and the healthcare system. And since the majority of home health services are covered by Medicare and Medicaid, medical social workers are well placed to provide emotional support and resources for patients. The medical social worker in home health care is an essential member of a medical team. The social worker's job is to help patients cope with the stress and anxiety that often accompany the recovery process. By educating patients about resources available, medical social workers can help them comply with medical recommendations and avoid hospital readmissions. They also educate patients about the support services available to them in their local community. They provide emotional support and education, which can lead to better health outcomes. Chapter 44: Director of Nursing in Home Health. The Director of Nursing, or sometimes referred to as Director of Patient Care Services (DPCS), is a more senior member of the agency. They are managers of the home health agency, especially pertaining to clinical care, but with administrative and business duties as well. Directors work closely with the administrators or owners of the agency to make sure the business is functioning optimally. With extensive experience under their belt, a DPCS in home health provides all clinical staff with the knowledge and skills they need to manage a successful organization. In addition to developing clinical care services, The DPCS oversees agency nursing personnel and contracted services. In addition to overseeing patient care, a DPCS oversees staff meetings, case conferences, and in-service training programs. In addition to overseeing clinical records, the DPCS represents home health on various committees. They must adhere to a set of standards of care and adhere to legal, regulatory, and accreditation standards. To become a DPCS in home health, one must be a registered nurse with at least 3 years of experience in the field. To become a DPCS, one must have at least a bachelor's degree in nursing and at least 1 to 3 years of home health care supervisory experience. A DPCS also oversees the assignment of appropriate staff to each case. Besides overseeing the staff, DPCSs must follow state laws and policies. They must review patient medical files on a regular basis. DPCS responsibilities in home health are important to the safety of a patient. An agency that meets these requirements should notify the patient of the payment source and complaints procedure. They should not discharge a patient without consulting with a physician. They must also inform their patient's legal representative, attending physician, or advanced practice nurse prescriber. These individuals must receive written notice of the fees and terms of service. Chapter 45 Primary Care Provider Roles. A primary care provider is one of the most important doctors in a patient's healthcare system. Performing at their highest level, primary care providers improve patient health dramatically. They provide general medical care, coordinate care with other physicians, and develop relationships with their patients. However, this doctor can also specialize in a specific area of medicine. The PCP is typically the one to officially certify the patient for home health services, providing general medical care. It has been found that readmission to hospital inpatient care is drastically reduced if the patient sees their PCP within 2 weeks of discharge. This is why, as home health providers, you have a distinct advantage if the patient sees their PCP as soon as possible after discharging from an inpatient facility, and is the reason why most home health nurses encourage their patients to see their primary care providers. The primary care provider may prescribe new medications, diagnose new illnesses, or order new tests. It is up to the home health nurse to update the patient's chart in the home health agency's EMR to reflect these changes made by the PCP, and to follow through on the orders of the PCP to ensure the plan of the PCP goes smoothly. The PCP often, through their knowledge and expertise, make the job of the home health nurse easier by providing them the proper plan of action during visits to medically stabilize the patient so patients remain in the home safely and prevent exacerbation of symptoms that may affect the star rating of the home health agency. Providing general medical care involves the care of patients of any age, regardless of their illness or ailment. As a primary care physician, they listen to patients' symptoms and diagnose illnesses, and work with other doctors and specialists to provide complete care. In some cases, you may work in a family practice or at a doctor's office. In general, though, primary care physicians are the primary providers of health care, not specialists. Some patients seek specialists directly, but this is not the best practice. It is up to the home health nurse oftentimes to educate the patients and their families on the importance of the primary care provider. PCPs are also sometimes referred to as gatekeepers of the healthcare system. Prevention of disease. The prevention of disease is an important component of the PCP and goes in tandem with home health care. These services are delivered by a primary care provider or a nurse practitioner. They can address chronic conditions and disabilities as well as the home environment. These services may be provided through a multidisciplinary team or referral to a healthcare professional. These services aim to minimize negative outcomes and maximize positive ones. For example, they can improve the quality of life and reduce medical expenditure for patients. Access to primary care is a key aspect of a patient-centered medical home. Increasing access to primary care practices can help control medical costs while improving the quality of care. Many practices have begun transforming into patient-centered medical homes. These practices will involve patients in treatment decisions, hire nurses and care managers to follow up with patients and coordinate their care. This model focuses on prevention and chronic care as well. A primary care provider's role in a medical home is critical to the patient's health. Medical homes must be located within the medical neighborhood. This area includes hospitals, specialty physicians, social workers, long-term care facilities, and mental health providers. Often, a primary care provider coordinates care with other providers so that patients do not fall through the cracks. In addition, the primary care provider ensures continuity of care, ensuring that the patient does not experience duplicate care or slip through the cracks. Management of chronic conditions. For thousands of Americans, managing chronic conditions in home health is a daily struggle. Thankfully, there are many resources for chronic disease management, including a primary care provider who can answer questions and walk with patients through the process. Chronic conditions typically require more intensive care than acute illnesses, and a primary care provider can help ease the burden and make the process as smooth as possible. Managing chronic conditions is critical to the quality of life of many individuals with chronic illnesses. While many people deal with multiple chronic medical conditions, the majority of time is spent managing these problems, which can be exhausting. Chronic care management helps people with multiple chronic illnesses achieve their health goals and enjoy life to the fullest. The program is also helpful for hospitals, which can react to a patient's health changes as they happen and reduce in-person visits. Chronic illness can be a debilitating experience for the individual, family, and caregiver. The Center for Medicare and Medicaid Services recognizes in-home nursing as an integral component of primary health care. It defines in-home nurse care as care coordination outside of the office. It aims to improve healthcare delivery and quality by helping people manage their chronic conditions more effectively at home. Moreover, this program supports the integration of healthcare and community resources. Managing a patient's overall health care. Managing a patient's overall health is a crucial aspect of being a primary care provider. It involves guiding patients toward good health, preventing illness, and managing stress. It involves monitoring vaccines and other screening tests to check for disease and provide treatment when problems do occur. Managing a patient's overall health care may also involve working with other health professionals, such as emergency room doctors and psychiatrists. In general, healthcare professionals have traditionally fallen into one of two categories: specialists and primary care providers. With the rise of the value-based care reimbursement model, healthcare organizations are forced to rethink how they deliver healthcare. By combining primary care and specialty care, these teams are better equipped to identify and manage populations at high risk. Ultimately, the aim is to improve the quality of care and length of life of patients with chronic conditions. Among the most important aspects of being a primary care provider are quality of care, cost effectiveness, and patient satisfaction. Coordinating care with other physicians. Coordination of care means carefully planning the activities and communicating patient preferences to all care providers. Proper coordination can improve the safety and quality of patient care. Information about patients' needs, preferences, and other details must be communicated to the right people at the right time. Primary care providers coordinate care with other physicians and other health professionals to ensure that patients receive safe and appropriate care. However, coordinating care can be challenging, and it can seem like too much work. Research from Accenture shows that patients prefer their PCP to be the epicenter of care coordination. Almost 3/4 of respondents said that their primary care provider should be the epicenter of care coordination. This patient-centered approach extends beyond simply making referrals. Primary care providers are the first point of contact for patients with multiple medical conditions. Patients' experiences with a PCP may impact their care with other providers. Lack of coordination of care between primary care physicians and other health providers can be dangerous. For example, patients may not get informed about the use of emergency departments unless they are referred to their primary care physicians. This lack of communication may lead to patients being prescribed medications that they are not able to tolerate. Primary care physicians may be able to advocate for less expensive care if they know more about their patients. A physician's knowledge of a patient's condition is crucial for the best care. Integration of primary care and specialty care has become a critical component of a healthy health system. Increasing use of hospitalists and smaller practice consolidations may encourage PCPs to reduce their call responsibilities and maintain a more balanced lifestyle. However, increasing hospital ownership of primary care practices can also help physicians develop protocols for care coordination. Building relationships with patients. Patients' first visits to their primary care providers often influence their attitude toward the healthcare provider. Fostering the initial patient-provider relationship. A patient's initial judgment of a physician can affect a number of outcomes. Building relationships with patients is equally important in establishing trust and fostering positive health outcomes. Patients should be involved in the decision-making process, which helps to establish trust between the patient and the physician. Building a good rapport requires compassion, empathy, and assertiveness. It also means that the patient feels heard, seen, and cared for. Finally, the relationship must be based on understanding and compassion. It can be difficult to overcome the barriers that prevent patient-provider relationships, but it is worth it in the long run. Patient-provider relationships can benefit the patient in many ways. Oftentimes, patients feel more comfortable discussing sensitive issues and medical concerns with their primary care provider. Furthermore, patients are more likely to seek care from a physician who shares a common sense of values, including honesty. These factors can go a long way towards strengthening a patient-physician relationship. It can lead to better health outcomes. Chapter 46: What is a primary caregiver? Primary caregivers are the people most often in personal contact with the patient in their homes. They usually are with the patient for 4 to 8 hours or more on a given day for several days a week. PCGs typically are not employed by the home health agency. They may be outside caregivers from a third-party agency, a family member helping out, or even a friend or neighbor doing a favor for the patient and their family. PCGs are critical for home health agencies. However, having a primary caregiver is actually a criteria for getting home health services. Typically, the home health agency teaches the PCG certain skilled tasks if the patient is not capable of performing them, and the home health agency relies on the PCG in partnership with the patient to become more independent in the home. PCGs significantly reduce the risk for hospitalization for patients, similar to how seeing the PCP within 2 weeks reduces the risk of readmission to hospitals as well. Having the contact information of the PCG is a critical piece of data for nurse to gather so that the agency has a form of constant contact with the patient through phone, text, voicemail, or email. Providing care for a loved one can be a tremendous burden. Thankfully, there are many options to relieve this burden. You can find help with mobility issues, providing emotional support, and lessening the burden of caregiving. Here are some tips for family primary caregivers. Responsibilities. Primary caregivers have responsibilities that range from basic assistance with daily activities to taking care of a patient's nutritional needs. Whether the patient lives with Alzheimer's or a different condition, the PCG can help ensure their daily needs are met. A primary caregiver may also take on the role of a household manager, tackling tasks such as laundry, grocery lists, and financial management. Caregivers often neglect their own health and well-being and need assistance with daily activities. Fortunately, there are many services that can help caregivers manage this job. Some primary caregiver responsibilities include assisting the care recipient with medication and errands. They may also assist with transportation and make sure the patient gets to doctor appointments. Additionally, they may help the care recipient get dressed and undress. Primary caregivers help their loved ones maintain their independence by helping them with routine activities, such as cleaning up after illness. They may even help the patient maintain a hobby or interest. Primary caregivers must be aware of the fact that the task can be difficult, and they need to balance their own life with their duties. It is important to remember that the caregiving role is demanding and can lead to exhaustion. The primary caregiver's job may be so demanding that they must modify their schedule or even leave their job. They may have to give up their career and interrupt their education. However, there are resources available to support them and minimize their stress. The duties of a primary caregiver vary greatly, and the type of care you are providing may be dependent on the condition of the person you are caring for. If you're caring for someone with Alzheimer's, the list will be a bit more extensive. One of the most challenging roles a primary caregiver will have is caring for a parent who has become ill. The caregiver's stress levels can be extremely high, and the constant juggling of tasks may lead to caregiver burnout, which affects both mental and physical health. Additional financial burdens include a limited income and medical expenses. You may not be able to work full-time to meet these needs. Bonding with patients. A positive emotional connection can be created between the caregiver and the patient. This connection creates a sense of trust between caregiver and patient, facilitating open communication between the two. The caregiver can discuss the care needs of the patient without causing resentment, allowing the caregiver to provide the best care possible. However, it is important to recognize that emotional connections are often difficult to establish. In order to create a positive emotional connection, caregivers should consider identifying what they need from their caregiver. Family caregivers. As a family caregiver, you may be able to take advantage of various home health care programs to help you provide care for your loved one. First of all, you can check if your loved one is eligible for these programs. This way, you can get reimbursed for your services, such as within-home supportive services benefits in California for those covered with Medi-Cal. Tax credits for family caregivers may be available. A bipartisan bill, the Credit for Caring Act, provides a tax credit to family caregivers for up to $2,000 in expenses related to caring for an elderly relative. This credit is available to caregivers who earn more than $7,500 a year and incur long-term care costs. This is typically when medical social worker is useful to consult with to discuss these types of community resources that may be available to the patients and their families. Family caregivers in home health services programs are also available to individuals who are not employed by a healthcare agency. These programs are run by the state's Department of Aging. Typically, these programs offer limited supplemental services to caregivers, such as prescription reminders, training, and counseling. Additionally, you'll have access to healthcare professionals, such as pharmacists and social workers, if needed. While most family caregivers are responsible for providing assistance with IADLs, the majority of family caregivers also assist their care recipients with personal hygiene tasks. In fact, 99% of the family caregivers provide assistance with meal preparation, transportation, and grocery shopping. Those ADLs are vital to a senior's health and well-being. But even though the number of family caregivers is small, it is still significant. Unlike traditional home health care, a consumer-directed home care program offers the advantage of allowing the care recipient to choose their caregiver. Under the program, you can choose between family members or friends who are eligible to work. The main difference is that spouses are not permitted to work as caregivers, and family caregivers can only be hired in rare cases, especially for elderly people with dementia or other serious conditions. If a family caregiver's financial situation is too tight, this program may be an option for you. Chapter 47: The Role of the Pharmacy. Dispensing. The pharmacy is an outside agency apart from the home health agency. The pharmacy is responsible for dispensing medications to patients after receiving orders from the patient's provider. For home health patients, they may receive their medications by mail. However, if patients do not have access to that service, their caregivers typically drive to the pharmacy and pick up their medications for them. Some pharmacies even set up reminders of patients to pick up their medications when it needs refilling. Collaboration. Home health nurses, home health aides, and pharmacists can collaborate to improve patient outcomes by providing drug and treatment information. The importance of providing this information cannot be overstated. Patients often have questions, and pharmacists can help by providing patient-friendly information. In the past, pharmacists have not collaborated well with nurses and home health aides. The lack of proximity and distance to hospitals and physicians can limit their collaboration. However, pharmacists and nurses can improve their working relationships by collaborating with other healthcare professionals. Pharmacists have extensive training to provide basic healthcare services to patients. They can help patients manage diabetes by explaining how to use a glucometer and interpreting readings. They can also help patients find over-the-counter medications for common ailments. These services should be offered by pharmacists in home health, and pharmacists can also provide patients with information about the use of medications and the effects they may have on the body. The pharmacist should be competent to perform the home health infusion. In addition to receiving proper training, pharmacists should take part in a competency assessment program and continue their education. The assessment of their knowledge, skills, and experience should be valid and documented. The pharmacist should provide accurate information to patients about their medication therapy. They should also be able to answer patients' questions and address their concerns in a concise and timely manner. There are also various types of drug therapy, and pharmacists play a pivotal role in managing and promoting cost-effective care. PBMs, hospitals, health plans, and accountable care organizations routinely utilize pharmacists to reduce costs and maximize patient outcomes. In addition, pharmacists can assist physicians and healthcare providers by assessing the effects of drug therapies, making recommendations, and recommending alternatives. They should develop comprehensive services to address factors unique to home infusion. The development of comprehensive services is particularly important in a home infusion pharmacy because caregivers often lack adequate healthcare training and knowledge. It is critical for caregivers to be trained to administer medication and operate appropriate devices for their patients. Home health agencies are responsible for teaching caregivers and making sure caregivers perform the skilled medical tasks well. Moreover, many medications require aseptic compounding in quantities sufficient to last for a week, and delivery under controlled conditions to ensure product potency and purity. Moreover, home infusion pharmacies should develop systems and policies that ensure quality and safety of care. While home infusion pharmacies provide consultations by telephone, pharmacists should consider expanding their reach by developing a home visit program. Home visits should improve patient compliance and simplify complicated drug-related issues for patients. A pharmacist should be available 24 hours a day to answer questions. In addition, A home visit may be helpful to ease the transition from hospital to home, and pharmacists should take an active role in infection control activities. A pharmacy director should ensure the effective use of personnel and resources. The resources should be sufficient to protect patient confidentiality. The pharmacy director should ensure that staffing plans reflect factors such as weekend hours, flex time, and exempt or non-exempt status. The director should also consider other factors that affect pharmacy staffing, such as on-call pay and shift differentials. In addition, a pharmacist should ensure the confidentiality of patient information. The pharmacist should document all clinical actions and recommendations in the home infusion patient's medical record. Moreover, pharmacists should consult other health professionals and document the consultations and outcomes in the patient's medical record. The pharmacy should develop a process for consistent documentation and reporting of services. Finally, pharmacists should ensure patient privacy at all times. There should be appropriate training for all employees working in a home infusion pharmacy.